Hi, everyone. My name is Dr. Elena Karn. I'm here to talk to you today about the P1CaLL study, also known as the Phase 1 Caregiver Lifeline Study. From the literature, we know that this caregiver population faces high levels of uncertainty and distress, and that caring for a loved one enrolled in one of these trials can lead to increased perceived caregiver burden and decreased self-efficacy related to caring activities. So we sought to examine the feasibility, acceptability, and preliminary efficacy of this pilot intervention. Those that enrolled in the study completed baseline assessment, received 4 weekly telephone-based sessions on stress management with a master's level counselor. After completion of those sessions, were randomized on a 1-to-1 ratio to receive 4 sessions of cognitive behavioral therapy or meta-meditation. They then completed post-assessment at 9 weeks, and those that completed all intervention sessions completed a qualitative interview. We use Wilcoxon-Sain-Rinks tests for continuous variables, Fisher's exact tests for categorical variables, and Cohen's d for effect sizes. And this is an overview of the different measures we use to assess feasibility, acceptability, and psychosocial outcomes. You can see from this figure here that this is also an overview of the different topics covered across the 8 sessions. Overwhelmingly, our sample identified as female, white, married, spousal caregivers employed full-time, average age 57 years old. Then if you look on the right-hand side of the screen, you can see that we had 23 caregivers complete baseline assessments, we had 9 caregivers complete all intervention sessions, and we had 21 caregivers complete post-assessment, as well as 5 caregivers completing qualitative exit interviews. On the left-hand side of the screen here, you can see that overwhelmingly caregivers felt that the intervention was acceptable. If you look at the mean scores, higher mean scores are indicative of greater acceptability. I would like to note that caregivers felt like their needs were met by the program and they were able to manage stress and they were able to meet the needs of their loved ones. We did not note any significant differences in psychosocial outcomes. We did note small effect sizes for degree of belief in negative automatic thoughts and anxiety. We also found a moderate effect size for a decrease in perceived caregiver health problems. So we can conclude from this study that we're able to demonstrate preliminary acceptability, limited feasibility. The intervention may have buffered against negative automatic thoughts and anxiety and perceived caregiver health problems. I would like to note a few limitations, such as the sample size, lack of control group, and future directions include looking at a larger study to assess intervention efficacy. Thank you.